Imagine this scene. It is the year 1968 in a small and conservative village in Bavaria, West Germany. Imagine Anneliese Michel, a 16-year-old girl gifted with superior technical intelligence and a deeply religious upbringing. Visualize Anneliese, a dedicated student who suddenly suffers her first biological fracture. During the night, her body becomes rigid. She feels an invisible weight on her chest, a pneumatic pressure that prevents her from breathing or screaming. This is the primary behavioral data point, the beginning of a neurological sabotage. Doctors diagnose temporal lobe epilepsy, but the architecture of her mind begins to reject the chemical solution. The trail of this investigation does not start in churches, but in psychiatric hospitals, where the technical failure of anti-convulsant drugs allowed a religious psychosis to take root. The archive is open. The timeline of Anneliese Michel's biological exclusion begins with an electrical discharge in the brain that science could not contain. Technical density expansion. Temporal lobe epilepsy can induce complex auditory and visual hallucinations. Anneliese's EEG in 1969 showed traces of focal convulsive activity, but the transition to a state of religious delusion suggests a failure in the recalibration of the central dopaminergic system, creating a zone of silence between medical treatment and spiritual conviction. The progression of the case reaches a phase of clinical sabotage in 1973. Anneliese is treated with Tegretol and Dilantin, drugs designed to stabilize the voltage of her neurons. However, she begins to see demonic faces during her prayers and smells sulfur, a common forensic marker of olfactory hallucinations linked to brain lesions. Imagine the technical frustration. The pills enter the bloodstream, but the exclusion continues. Anneliese decides that her pathology is not mechanical, but metaphysical. She begins to eat insects, drink her own urine, and bark like a dog under tables. This is a total restructuring of human behavior. We analyze this as a severe reactive psychosis, where the patient sabotages their own body to validate an external belief. The chemical trail is abandoned in favor of a medieval intervention. The power dynamic shifts from neurologists to two priests, Ernst Alt and Arnold Renz. Technical density expansion. Abrupt discontinuation of psychotropic drugs can cause a neurochemical rebound effect, exacerbating episodes of hyperreligiosity and aggression. Forensic analysis later suggested that the interaction between underdosage and the environment of religious reinforcement accelerated the collapse of the prefrontal cortex, eliminating Anneliese's ability to distinguish the trail of reality from her own internal narrative. Imagine the scene in the basement of the Michel house in 1975. For 10 months, 67 exorcism sessions are performed, each lasting 4 hours. This is a marathon of biological exhaustion. The clinical reconstruction of the sessions reveals extreme physical pressure. Anneliese performs more than 600 genuflections per session, forcing her knee joints to the point of mechanical rupture. Imagine the sound of her tendons snapping as she repeatedly throws herself against the floor. The priests use tape recorders to document the sonic trail of the voices. The recordings reveal vocal distortions that defy common laryngeal anatomy, a phenomenon of hypertension of the vocal cords induced by trance states. We analyze this as a deliberate physical sabotage in the name of a ritualistic protocol. Anneliese's nervous system is at war with her muscular structure. Technical density expansion. Repetitive physical exertion during genuflections caused acute soft tissue inflammation and microfractures in the patellae. The audio trail captured shows harmonic frequencies suggesting extreme subglottic pressure, common in states of acute psychosis where the autonomic system is in constant survival mode. The most severe data point in this investigation is the nutritional exclusion. Anneliese stops eating, claiming the demons do not allow it. Imagine the body of a 23-year-old woman consuming its own muscle mass to keep vital organs functioning. This is metabolic sabotage. By late 1975, her weight drops to 30 kilograms. The biological trail is visible: sunken eyes, translucent skin, and extreme vulnerability to infection. We analyze the failure of the authority figures around her, parents and priests, who observed this physical deletion and interpreted it as a sign of sanctity rather than a medical emergency. Anneliese's support structure became her greatest sabotager. Every denied calorie was a step toward the forensic conclusion. Technical density expansion. Prolonged starvation leads to severe ketosis and electrolyte imbalance, affecting the heart's electrical conductivity. The metabolic trail indicates that in the final weeks, Anneliese suffered from generalized muscular atrophy, which prevented any coordinated motor movement, leaving her in a state of technical immobility before final cardiac arrest. Imagine the early morning of July 1st, 1976. Anneliese is in her bed, weighing only 31 kilograms. Her final words directed to her mother are, "Mother, I am afraid." This is the final trail of human consciousness before biological shutdown. Her immune system, devastated by pneumonia and high fever, gives up. Anneliese Michel is declared dead. The technical cause, malnutrition and dehydration. This is a crime of omission and negligence disguised as spiritual intervention. Anneliese's exclusion was not caused by entities, but by the failure of a system that preferred the trail of myth over the trail of medicine. The forensic trail of the autopsy revealed that at the time of death, she had no body fat and her joints were destroyed. The archive now transitions to the courtroom. Technical density expansion. Aspiration pneumonia is a high risk in patients debilitated by prolonged exorcisms. The autopsy confirmed that death was the mechanical result of multi-organ failure caused by a state of extreme starvation, where the body entered total catabolism, consuming its own cardiac tissue to survive. The investigation moves to the court in Aschaffenburg in 1978. Imagine the scene: two priests and Anneliese's two parents in the dock. The charge is negligent homicide. The dynamic power of science faces the power of faith. Defense lawyers present the audio tapes as evidence of an irresistible force, but the court focuses on mechanics of survival. Forensic medical examiners state that Anneliese could have been saved by forced feeding just 1 week before her death. This is a sabotage of parental responsibility. The verdict is a 6-month prison sentence, suspended for 3 years. The court decided that Anneliese's deletion was avoidable. This case became a permanent legal trail in Germany, defining the limits between religious freedom and the technical obligation to preserve life. Technical density expansion. The trial utilized the concept of guarantor, where parents and priests had the technical duty to intervene when the subject's physical integrity was in imminent risk. The exclusion of spiritual evidence by the court solidified the primacy of the biological trail over the subjective narratives of the patient and her caregivers. Years after the death, the trail of Anneliese Michel continues to haunt Bavaria. Her grave became a site of pilgrimage, a trail of devotion that the Catholic Church tried to distance itself from. In 1978, her body was exhumed due to rumors that it would remain incorrupt. Imagine the forensic trail. The remains were in a normal state of decomposition, destroying the last myth of a miraculous biological exclusion. We analyze this case as the greatest failure of psychiatry and theology in the 20th century. The film The Exorcism of Emily Rose tried to give a narrative structure to this tragedy, but the reality was much more technical and cold. Anneliese was a victim of a closed circuit of beliefs that prevented her from accessing the trail of recovery. Technical density expansion. The exhumation revealed that the preservation of the body did not exceed the normal thermal and chemical parameters for the region's soil. Anneliese's historical trail serves today as a clinical warning about shared delusion or folie à plaisir, where the social environment validates and amplifies individual pathology until biological extermination. The final minute-by-minute reconstruction of Dossier 23 ends here. Anneliese Michel was deleted by a lethal combination of untreated epilepsy, religious psychosis, and institutional negligence. The trail she left behind is not voices on tapes, but a severe warning about the fragility of the human mind when isolated from science. The biology of pain and the panic of a besieged mind are immutable facts. Anneliese's file is proof that sometimes the greatest demons are those created by silence and omission. Your mind is the final piece of this investigation. Join our community by clicking the subscribe button. Help us follow the trails that history tries to hide. I am your guide through the shadows, and I will return with a new dossier very soon. Keep your mind sharp. Focus on the facts with your eyes closed. And remember, every body tells a story, even when the spirit is gone. This is Mind 74, and we are the keepers of the cold files. The investigation is suspended, but the case remains open. Until next time. Technical density expansion. The Michel case resulted in the reformulation of exorcism protocols in the Catholic Church, now requiring a mandatory technical psychiatric evaluation. Anneliese's biological exclusion remains a terminal marker in the history of German forensic medicine.